Welcome back to Face the Nation. We want to go next to the former director of the Cybersecurity and Infrastructure Security Agency, Chris Krebs. Good morning, Chris. I want to start with the Colonial Pipeline. It was not intended to undermine American infrastructure, but it suggested some vulnerabilities. What did we learn?
Good morning, John. First, I think that if there was any remaining question as to whether cybercrime and ransomware in particular was a national security threat, I think that question resolved itself over the last week. I think one of the key things I took away from the last week is that business executives have to stop looking at cybersecurity as a technical risk issue, and it truly is a business risk. I mean, we're talking resilience of the national economy. We've got to do a better job in terms of closing out vulnerabilities and making our systems and our operations more resilient.
The president signed an executive order this week to try to get at some of those issues. What's your evaluation of that executive order?
I think it's a really ambitious plan. I think it should be effective if implemented properly, which I have confidence in the team, both at my old agency as well as in the National Security Council and elsewhere. But the benefit here is that typically executive orders really only apply to the federal government. And what we're going to see is through the power of the purse, through the purchasing apparatus of the United States government and the software from U.S. tech companies and others, we're going to see improved security standards and improved security performance. And there's a trickle-down or cascading effect where the government buys the same things that we do out in industry and at home. So the all boats should rise with the tide here.
So your argument is that if companies have to step up their game to provide products to the government, they'll use those same new, higher quality products they create in the private sector.
They're not going to build two different engineering teams to develop software. The same code that goes out for government is going to go out to industry, and you're going to see better security out there as a result, and I think that's a great thing.
You talked about execution, always a trick in government. A lot of great plans, execution's the challenge. The position you held, there is an acting, not confirmed director. Is that a problem, and should that be fixed quickly?
Well, I'm really optimistic by the candidate or the nominee that the president picked, Jen Easterly, and he even earlier this week encouraged the Senate to take up that nomination quickly. I've known Jen for years. She's an incredibly effective leader. She's spent time in government as well as industry, and she knows what it takes to get the job done. But it takes more than obviously one person, and there is going to be a significant lift required by not just my old agency, but really every government agency, and it's going to require some resourcing. So the Congress needs to put into place additional personnel as well as funding to execute these programs across the government.
And just to pull people back into the stakes here, what was exposed by this ransomware attack, give us a sense of what we should think about in terms of the possibility of future challenges on the national security and infrastructure front.
Well, this is ransomware in particular, something I've been barking about for a number of years. Unfortunately, I think it's been treated as a law enforcement matter and not necessarily a national security threat, so you didn't necessarily get the full attention of the U.S. government and some of our allies. But I think we've broken through that threshold. And I think the way we're going to get past ransomware, it's going to take kind of a three-pronged approach. First is that we need every organization to improve their security, and as the Congress contemplates an infrastructure bill, they've got to include cybersecurity investments in that bill. And the second thing we have to do is we have to break the business model. Ransomware is a business, and business is good. I've said that 1,000 times. So we've got to go look at what enables it, and that includes cryptocurrency, as well as whether we can pay, whether ransom should be paid, and if so, how is that categorized or logged? And then the third thing is we have to go after the actors. Chairman Schiff mentioned it earlier. We have a set of tools that we can use to deplatform effectively these ransomware actors. But the last piece here is that when the president goes and meets with President Putin over the summer, this has got to be on the table. Sovereign states do not allow criminal enterprises to operate out of their territory like this without repercussions.
On the question of ransom, is there any way to make paying ransom illegal, and do you think that should be on the table?
Yeah, sure, it could be done with the stroke of a pen. Legislation could state that. I think there needs to be, though, a very thorough policy conversation. I think there's absolutely some edge cases where the payment of a ransom as a last resort may be necessary, and that's a case where a hospital where lives are at stake might be justified. I do not like saying that because I think it could actually put a target on them, but nonetheless, I think there are probably some edge cases. But at a bare minimum, any organization that suffers a ransomware attack should be required to notify the federal government. And I think one element we may be able to look at is seeking a license to pay that ransom, where the information on the victim is tracked, as well as where that money goes, so we can continue to paint up the criminal ecosystem of ransomware.
All right, Chris Krebs, we're likely to be coming back to this issue again, as prevalent as it is. We appreciate your time this morning. And we'll be right back in a moment with Dr. Anthony Fauci. Now we turn to the coronavirus pandemic and President Biden's chief medical advisor, Dr. Anthony Fauci. Good morning, Dr. Fauci.
Good morning, John. Good to be with you.
It's good to be with you. The new guidance on masks is confusing people a little because 2 weeks ago, the CDC said that people who had been vaccinated were safer while wearing masks. Now there's new guidance. What changed in that period?
Well, what's happened, there's been an accumulation of data, John, showing in the real world effectiveness of the vaccines. It is even better than in the clinical trials, well over 90% protecting you against disease, number one. Number two, a number of papers have come out in the past couple of weeks showing that the vaccine protects even against the variants that are circulating. And thirdly, we're seeing that it is very unlikely that a vaccinated person, even if there's a breakthrough infection, would transmit it to someone else. So the accumulation of all of those scientific facts, information, and evidence brought the CDC to make that decision to say, now, when you're vaccinated, you don't need to wear a mask, not only outdoors, but you don't need to wear it indoors.
So on that third point, let me ask you this. If I have no symptoms and I've been vaccinated, but I'm infected, what's the difference between that and if I have no symptoms and am infected but have not been vaccinated?
Good question, John. And what the issue is that the level of virus in your nasopharynx, which is correlated with whether or not you were going to transmit it to someone else, is considerably lower. So even though there are breakthrough infections with vaccinated people, almost always the people are asymptomatic, and the level of virus is so low it makes it extremely unlikely, not impossible, but very, very low likelihood that they're going to transmit it. Whereas when people who are getting infected, who are without symptoms, who are not vaccinated, generally the titer or the level of virus, relatively speaking, is higher than in the vaccinated individuals.
A lot of people have heard about the Yankees. 8 members of the club have tested positive, but it seems to bear out what you're saying, which is most of them have no symptoms, and what you seem to be saying is they have no symptoms and we don't need to worry about them spreading because they've all been vaccinated.
Well, yeah, I mean, it's not going to be absolute zero, but the likelihood, John, of their spreading is really very, very low. And that's one of the reasons why they're even talking about, if you are vaccinated, that you're going to cut down on the testing of individuals, because even if they test positive, the likelihood of their transmitting to someone else is really very, very low.
So if a person is deciding whether or not to get vaccinated, they have to keep in mind whether it's going to keep them healthy, but based on these new findings, it would suggest they also have an opportunity, if vaccinated, to knock off or block their ability to transmit it to other people. So does it increase the public health good of getting the vaccination or make that clearer based on these new findings?
Yeah. You know, John, you said it very well. I couldn't have said it better. It's absolutely the case. And that's the reason why we say when you get vaccinated, you not only protect your own health, that of the family, but also you contribute to the community health by preventing the spread of the virus throughout the community. In other words, you become a dead end to the virus. And when there are a lot of dead ends around, the virus is not going to go anywhere. And that's when you get a point that you have a markedly diminished rate of infection in the community. And that's exactly the reason, and you said it very well, of why we encourage people and want people to get vaccinated. The more people you get vaccinated, the safer the entire community is.
Dan, do you think now that this guidance has come out on relaxing the mask mandates if you've been vaccinated, that people who might have been hesitant before will start to get vaccinated in greater numbers?
You know, I hope so, John. The underlying reason for the CDC doing this was just based on the evolution of the science that I mentioned a moment ago. But if, in fact, this serves as an incentive for people to get vaccinated, all the better. I hope it does, actually.
On the public health messaging of this, this kind of caught some people by surprise, and because people have been so confused over the course of the last 14 months, would it have been better to prepare the way a little bit more for this? Good news, of course, for everyone, but because there's been so much confusion over time, would it have been better to kind of walk people up to this very kind of head-snapping new news?
Well, you know, John, people will say that. There may be some merit to that, but as a matter of fact, the CDC did this and took this action based on the data. What they'll do now, and I know we've discussed that with the CDC director, what they'll be doing now is coming out very quickly with individual types of guidances, so people will say, well, what about the workplace? What about this? What about that? And I think that's going to be clarified, John, pretty quickly. I would imagine within a period of just a couple of weeks, you're going to start to see significant clarification of some of the actually understandable and reasonable questions that people are asking.
You have, throughout your career, talked a lot about vaccinating other parts of the world. There's a moral case for doing it, and also because pandemics don't know anything about borders, the more that it's raging elsewhere, the greater chance a variant comes here. So how do you feel, given that vaccines are being made available now to teenagers where there's very low risk, and also people are turning away the vaccine? How does that make you feel, given the way you've talked throughout your career about the necessity of vaccinating the world, which the United States could do more to help with?
You know, John, that's a frequently asked question, and it's not an unreasonable question, but I believe strongly we can do both. You're absolutely right. I mean, I will reconfirm what I've said over many, many years, dating back to the HIV/AIDS issues, that I feel we do have a moral responsibility as a rich nation to make sure that others in poorer nations are not deprived of interventions that would be life-saving. But I think we can do both, John. I think we can vaccinate younger people, adolescents, and children at the same time that we put a major effort in getting doses of vaccines to those in the lower and middle-income countries.
All right, Dr. Anthony Fauci, we really appreciate you being with us. Thanks so much. And we'll be right back. The push to overhaul the military's handling of sexual assault cases is moving towards becoming law, thanks to the collaborative efforts of New York Democratic Senator Kirsten Gillibrand and Iowa Republican Senator Joni Ernst. The Department of Defense has maintained that they need to be in charge of prosecuting these cases. But Senator Gillibrand told us a lot's changed in the 8 years she's been pushing for this bill.
Unfortunately, because of their lack of ability to get this done, the rate of sexual assault continues to climb, but the rate of cases going to trial and the rate of cases ending in conviction is going down. So under no measurable is it getting better. What also recently happened was there was a report out of Fort Hood because a young woman named Vanessa Guillen was murdered. And they did a review of what that place was like, and they found it to be a toxic climate. So toxic that sexual harassment and sexual assault was not only rampant, but it was a permissive atmosphere for that type of behavior.
Senator Ernst, you were a commander in the National Guard. How has your thinking evolved on this issue since you've been working on it?
Well, this has been a very, very concerning issue for a number of years. Now, I do believe that, of course, that within the command, the chain of command, there needs to be some oversight. Because of that Fort Hood report, the horrible behavior, the bad command environment, it has really been obvious to me that we need to make a very different change. A large part of that is prevention. We know it's necessary to focus on that, because by the time we have a perpetrator and a survivor, then we know we've failed.
Senator Gillibrand, you have always pushed for taking the investigative power out of the chain of command. Why is that so important in this legislation?
Well, it's actually not the investigative power, it's the decision-making power about whether a case should go to trial after the military police have completed their investigation. And so we believe, based on what survivors have told us, is that if you have a trained, unbiased military prosecutor who makes that fundamental decision about whether a crime has been committed and whether there's enough evidence to go forward to trial, two things change. One, the prosecutor is going to choose different cases because they have better training, so they'll have better judgment about which cases they can take to trial and whether they can be successful. And second, the perception of the survivors will be that someone who's unbiased, who doesn't have skin in the game, who doesn't know the accused or the accuser, who doesn't have an interest in prosecuting one person or protecting one person over the other because of who they know and how valuable they are to the unit. This allows for professionalism in the adjudication of these cases, and we believe that a trained military prosecutor has the experience and know-how to do this in an unbiased way. That will allow the survivor community to come forward more often.
Senator Ernst, one of the main critiques of this decision to move out of the chain of command is that it undermines, in a specific and in general, the ability of a commander to hold his troops accountable, and that it changes the commander's role. What's your response to that?
Well, that has been my concern in the past, and certainly we want commanders to have control over their units and the soldiers or airmen, Marines, sailors within those commands. But what this does, it still allows the notification of that commander so that the commander still can go forward and make changes within that command. They should understand if there is bad behavior happening in that command, then they have the opportunity to fix it. And it is important because this will be a small number of crimes committed within the military. However, it will have absolutely the effect that we are hoping for, which is that it will go to a specialized prosecutor that will then be able to evaluate if that case moves forward or not. The commander still has the opportunity to discipline within the unit and create a much better positive command climate.
Senator Gillibrand, in 2014, John McCain told a story of a woman who came to him and said, asked him about her daughter entering the service, and he said he could not give his unqualified support because of the sexual assault conditions in the military. If someone came to you and asked you the same question, could you give unqualified support, or would you only do that after this legislation passes?
I would support any young person's desire to go into the military because it takes someone of enormous courage, bravery, and selflessness to put themselves in harm's way on behalf of others. But my job is to make that safe for any person going into the military. And so we believe that this professionalization makes a difference. One, it will make survivors and victims more comfortable and more confident about this system. And two, it'll have better outcomes. Because why are we asking commanders to go through these complex case files, maybe when they're deployed in Iraq or Afghanistan, when they should be focused on winning a war and training troops, with the complexities of a legal litigation? This should be given to a trained military prosecutor so they can focus on their day jobs, the ones that are so important.
Senator Ernst, you've talked about how you worked with Senator Gillibrand on this. Is this a template for bipartisan other kinds of bipartisan work?
That give and take process that we went through to arrive at a solution that has gained the support of 61 co-sponsors. So this is a template. We want Americans to see that bipartisanship is alive and well. It takes friendships, it takes a lot of discussions, and certainly a partnership and finding compromise through that collaboration. This is what the rest of the Congress should be doing at a time like this too, is taking a very real, a very personal, a very intimate issue and finding solutions. That's exactly what we have done in this case.
Senator Gillibrand, anything you would add to that?
I think many people in Congress are bipartisan, and we just have to keep reaching across the aisle, finding that common ground, and building solutions from the ground up. That's something Joni and I have been working together on the Armed Services Committee for the last 6 years, and we'll continue to do it.
Our full interview is available on CBSNews.com, and we'll be back in a moment. Before we go today, a new focus on freedom as fully vaccinated Americans begin to walk around without required face coverings. The CDC has eased mask restrictions, and the first days of barefaced delight might remind anyone who wore braces on their teeth of the day they came off. Suddenly, your mouth feels new. There are also likely to be psychological wonders as we rediscover human interaction we've been denied.
It's so freeing, especially coming right where the weather's getting nice and warm. It's perfect.
There will be public smiling in the street. Small talk is going to feel huge. The thrill of the normal will cause people to interrupt conversations to note how normal they feel. And remember the collective sound of human action? The roar of a crowd when a baseball clears the outfield fence. The harmony of voices filling large spaces. The symphony of a coffee shop. We are regaining freedom, a word that's been debated a lot. But while we prepare to dance in the streets, I'm reminded of these two dancers I filmed during lockdown. This awful time clarified for all of us the people and things in our lives we care about as much as those two cared about their dance routine. That's a freedom too, the freedom that comes from perspective, freedom to ignore the distractions and fake political fights, to focus on what gives our lives meaning and joy. If we can hang on to that freedom, it will make our new freedom all the more valuable. That's it for us today. Thank you for watching. Until next week, when we'll be speaking with former Defense Secretary Robert Gates. For Face the Nation, I'm John Dickerson.